I know the House is fully aware of the continued precarious trajectory of this disease around the world, and indeed the epidemiological situation in Ireland is stable, but it is, as we're all aware, under constant pressure. The incidence of COVID-19 is still high, though, as I said, it is stable. There are still considerable uncertainties around what measures may be needed over the course of the rest of this year. But we are united in our clear and ongoing objective to slow down and minimise the impact of this disease, and in so doing, protect the health of the public and dilute the impact of the disease on our society and on our economy. Some members of the Seanad on Monday referred to these powers as draconian, which is not an unfair description. In fact, I used the same description myself, both as Minister for Health and when I was Opposition Health spokesperson, when the initial bill was brought in earlier last year. So while they are draconian, the measures concerned have provided us with the necessary tools to stop this disease from spreading uncontrollably, especially the exponential spread of it, and to help us keep people safe, first and foremost. Ultimately, the measures have provided the means to protect public health and to keep people safe. Members of both houses, here and in the Health Committee, have also sought for the legislation to be reviewed. This is entirely understandable. In terms of the measures taken under the legislation, government decision-making has been and is informed by public health, economic and social impact assessments undertaken on an ongoing basis throughout the pandemic. And as colleagues will be aware, there is a very rich source of information available online from NPHET, the minutes of the NPHET meetings, the papers discussed by NPHETs, the analysis that gets provided to me, gets provided to government by NPHET on a weekly basis. The letters of recommendation from the Chief Medical Officer to myself are all available online, as they should be. Government has consistently sought to introduce measures which are necessary to protect public health, and they're kept under constant review. The measures have been tough and they have been very challenging, but they have worked. They have saved lives. They have stopped a lot of things happening in this country which happened in other countries, which were deeply, deeply worrying to see. We've had one of the lowest excess mortality rates from COVID-19 in Europe, and the measures we introduced and the public support for them, arguably more importantly, ensured that, unlike many other countries, while our health service ended up under very serious pressure, our health system was not overrun, our hospitals were not overrun, our emergency departments, our intensive care units were not overrun. Thanks to the public backing the measures, and thanks to the extraordinary work and ongoing work of our healthcare professionals. Vaccinations offer very significant protection at an individual and at a population level, but it is still going to be some time before there's a sufficient level of the population fully vaccinated. Moreover, while there is emerging evidence in relation to the efficacy and effectiveness of available vaccines, we still don't have full information in relation to the impact that vaccines have on transmission, the length of vaccine-induced immunity, and the potential impact that variants may have on vaccine effectiveness. In general, international agencies are continuing to advise the use of a range of non-pharmaceutical measures until there is a greater understanding of the role of vaccination on the course of the pandemic, and indeed there is a greater impact of the vaccinations on the disease itself. Specifically in relation to the date of November the 9th, which is proposed in the bill, this is a date that was informed by public health, with their view being that the measures might well be required into late autumn or early winter. Given that we expect to see a large amount of mixing indoors at that time. As I said, Ceann Comhairle, these measures are tough. They have been very, very difficult. We're all acutely aware of the impact of these measures on individuals, on families, on communities, on businesses, and on so much more. They have come at a serious cost, but they do work, and they have worked. And it is all our hope, I think, that the measures will only be needed for a very short time. Indeed, Ceann Comhairle, I've just come from a meeting with the Chief Medical Officer following NPHET meeting today in relation to advice that we'll be bringing to Cabinet on Friday. And I'm very happy to report, as I'm sure members will be aware, that NPHET's view is that the trajectory is positive. again, thanks to the Irish people getting behind the measures day after day after day and keeping those case numbers low, keeping the hospitalisations low.